Dental Week is the baby of the Dental Services Department. It's an outreach to the public in which we bring dental health education awareness to the communities throughout St. Vincent and the Grenadines. It is necessary because education is necessary. It is important that we bring constant and continuous awareness to the public so that they are educated as to how best they can take care of their oral health and therefore the overall health of their body. We want to bring to their consciousness the importance of brush.
Brush your teeth until they shine. Brush them up and down, brush them all around. Brush them until they're fine. Brush your teeth, brush your teeth.
I think that dental health is important for the students because they need to know how to take care of their teeth, and they are at the age where the things that they consume sometimes can be damaging to their teeth. So it is important for them to know how to take care of their teeth and what to do in case something goes wrong, if the teeth start rotting or for some reason they start feeling pain, what they need to do and where they need to go to get this help. So we really appreciate the Ministry of Health taking the time out to come here today and enlighten the children on how to take care of their teeth.
Good morning, everyone. My name is Dr. Daniela Dalrymple, and we're here at the Old Treasury parking lot. Today we have Dental Health Awareness Week. We are doing a dental fair. Right now, we're currently doing some screenings inside there. What we're doing is we're doing dental screenings, which involves looking inside the patient's mouth and basically letting them know what's happening, whether they need a cleaning, if they need fillings, things like that, and how we can help them moving forward. What we see in the Caribbean is a bit of a misconception when it comes to brushing, right? The way we are actually supposed to brush is we're supposed to be brushing in circular motions and an up and down motion. The reason why we don't suggest circular motions is strictly because we want to make sure that we are not putting any pressure on the gum lines, which is where the tooth joins the gum. Now, in terms of our toothpaste, we have our Press Kids, which is basically the best toothpaste to use. What we want to emphasize though is we want to emphasize the amount of toothpaste that you use on the toothbrush. So we're looking for a rice grain size toothpaste line on the toothbrush. In terms of all types of toothpaste, right? What we are suggesting is for the kids under the age of 6, we like to use a kid's toothpaste, and you have to look specifically for kids on the toothpaste. This is an adult toothpaste. We tend to recommend any Colgate or any brand that fits your budget is fine. We also like to encourage sensitive toothpaste, especially when you have sensitivity around the gum lines of the tooth. We don't specifically suggest it for cavities, but it's really for like when you have gum disease and recession. Now, we like an electric toothbrush just because, not because it does the work, but mainly because it helps with that additional reaching in the back there, and the movement itself of the electric toothbrush actually aids in the brushing. We have our baby toothbrush here for our little tyke. We also have our adult toothbrush. Now, in terms of mouthwash, what we tend to suggest is mouthwash is used at a time other than brushing and not while you are like after you brush. Now, we also have chlorhexidine, which is really a gum-related mouthwash, and that helps a lot with any gum diseases that patients have. But what we suggest as well is that you don't use it for more than 2 minutes. In terms of our flossing aids, we have our water flosser, we have our regular dental floss, we have our floss picks, we have our interdental brushes, our single tuft brushes, and of course we can't forget the tongue where you have your tongue scrape.